Welcome back to Insight. We're at Indiana Physical Therapy, and we're with Karina, and we want to talk about we talk about Indiana Physical Therapy every week, and physical therapy, we just kind of assume we all know what we're talking about.
Yeah.
Let's start over. What is physical therapy?
Well, this is a good question. I think a lot of people have a lot of misunderstandings about what physical therapy is. They're aware of people going in after a massive trauma, car accident, or a surgery. And so I get a lot of patients sitting in my clinic on that first day scared and in tears, and they've put that therapy session off and they've put their pain on hold for sometimes 2 and 3 months because they think that therapy is going to hurt. And that's not the goal of therapy. Our goal is to help to reduce pain, restore movement, restore function, and we do that through a variety of means. We do soft tissue massage and mobilization, joint mobilization, manipulation. We also do exercise, gait training. So there's a lot of different facets of physical therapy. People think that we're just going to run them through the ringer and it's going to be just this traumatizing experience. And it's one of the best feelings when those patients that come in fearful leave saying, I was so glad I came in today.
I think a lot of people, if they're not familiar with what goes on here, think, okay, post-surgery, post-accident, post, something traumatic. But a lot of times you guys step in and treat people who just have kind of that, they've moved the wrong way for too long.
Right. Most of the things that we treat are usually related to pain. Shoulder pain. People aren't sleeping at night because they roll over on that painful shoulder and it wakes them up. Back pain, neck pain. But I always tell people my youngest patient I've ever seen has been 5 days old. My oldest patient has been 97. We treat everything in between. And it's not all pain related. We'll get the athletes whose their golf swing is starting to lose some power because they're feeling like they're getting stiff in their shoulders and their trunk. And we can help to restore some of that movement when there's no pain there. We can just help to improve your quality of life.
Yeah, there's times I can feel it in my neck. Is when I'm like just doing something like just trying to turn backwards when I'm backing the car up, and I'm like, okay, that's really stiff. It's not painful, but it's one of those things that I don't want to lose that forever.
It's the start that something is changing that could potentially be negative down the road. So I find that people, when they go to therapy more preventatively like that, they live a longer, more fulfilled life that way.
Now, obviously, it would depend on the condition, but in general, can you ballpark how long a treatment? It's obviously not a one-time thing.
Absolutely.
What's that going to look like?
The average treatment will last about an hour, and it's a little bit more or a little bit less depending on the condition. The first day somebody comes in, we sit down, we'll get a very detailed history of what's going on. Most people don't know where their pain comes from. They just wake up like that one day. So trying to figure out where that dysfunction comes from, what types of treatments they've been able to do to help it in the past, and then we will take them through a series of movement patterns, test their strength to find out where that dysfunction occurs. And one of the things that we here at Indiana, like physical therapy, like to do is what we call comparable science. So we'll find something that hurts, find an appropriate treatment, treat it, and then have you try that again the same day. And a lot of times you can see that improvement in the same day, so you know that we're in the right ballpark and that we're going to make a difference.
And again, it's the no pain, no gain. You're not really a fan of that philosophy.
I'm not a fan of that. There's times when that's appropriate, but when you're coming in to treat pain, you don't want to make it hurt more.
Yeah.
So
again, constantly expanding Indiana Physical Therapy. If you want to find out more, the best way to get started is to do what?
Give us a call. Most insurance companies will allow you to see a physical therapist without seeing your physician first. Give us a call and find out, and we can direct you to whether you need to see your doctor or you can come on in.
IndianaPT.com for more information. We'll be right back on Insight.